Daniel Adibi, and I will be your host for Our World 101, the show in which we explain complicated, real-world events and issues to bridge people together. Today's topic is the novel coronavirus, COVID-19. After the first case was confirmed in Wuhan, China, it has spread and ravaged the entire planet. Since then, over 80 million cases have been reported, and there have been close to 2 million deaths. I wanted to do this episode because there has been a lot of misinformation about COVID, and there have also been reports of a disparity in treatment based on one's race. Here to talk to us today about the pandemic is public health educator and researcher, Dr. Lindsay Leininger, who is a clinical professor at Dartmouth Tuck School of Business. Welcome to the show, Dr. Leininger.
Thank you so much for having me, Daniel. It's great to be here.
Thank you for being here, and also thank you for guiding so many people through what has proven to be an awful year.
Oh, I appreciate those kind words.
So let our viewers know, what exactly do you do as a public health educator?
So I teach and research about all the influences on our health that are outside of the doctor's office. So you can think of things like healthy food, exercise, safe housing, clean air, clean water. These are all forces of public health. And so this is my field of study.
You told me before that you are part of a group called the Nerdy Girls. What exactly do you do in that group?
So as part of a team of all female scientists, we are affectionately dubbed the Nerdy Girls by our community. I am co-leading a public education campaign about the pandemic that provides timely and trustworthy information, primarily on social media, but we have other platforms as well.
I think it's remarkable that your Facebook page, Dear Pandemic, already has 55,000 people following. Can you tell us a little bit about that?
Sure. Thanks, Daniel. So we're really proud of being a facilitator of a community of people who are trying to navigate the information overwhelm that we're all coping with. As the pandemic rages, we also have what's called an infodemic raging. And you alluded to this in your opening comments about this issue of misinformation. But even broader than that, there's just so much information. It's kind of like drinking out of a fire hose. So our mission with our education campaign is to curate information that's needed and to translate the science into everyday living to help people cope with this information overwhelm that we're all surfing right now.
I agree. That's very important. And you're helping to get rid of that misinformation out there by decoding all the data, as you said.
Well, we're sure trying.
So what are the most outrageous myths about COVID you have heard thus far?
I think the myth that we really have to write very regularly on is that COVID is not the flu. COVID is much, much worse than the flu. And unfortunately, this piece of misinformation just won't die. It's like playing whack-a-mole. Like we write on the most recent data, how much deadlier, how much more transmissible COVID is than the flu. And then we're playing whack-a-mole because 2 or 3 weeks later, a new piece of misinformation circulates that suggests that COVID is no worse than a bad flu season. So let me be very clear on this point. COVID is both much deadlier and much more easily spread than the flu.
I agree. That's a crazy myth. Obviously, it's very, very deadly and very transmissible, as we have seen. How do you respond to people who say those comments?
We always lead with an open heart. We have to recognize the feelings that underlie comments like these. So often people are just confused. They've read a confusing piece of potentially misinformation and they just want some vetting. So in that case, we are happy to do the vetting. We're so glad people asked and brought it up. There are other people who, out of a sense of frustration, a desire to return to normalcy, understandably are unconsciously seeking good news and facts that fit this narrative, who want to believe that actually this isn't as bad, and therefore we can go back to normal. So we try to honor the emotion underlying why people are sharing this or spreading this. but we debunk the fact, or we debunk the myth with a lot of rigor. So we honor people's emotions, but we are very candid about the science.
You have to understand the emotions, but you have to also say the facts and put away the misinformation.
That's right. And we really have to always lead with respect, because if you come at a person with some data and something that makes them feel guilty or ashamed, they will close their mind and they will close their heart to you. So it's important to communicate with scientific rigor, but also with sensitivity.
Mm-hmm. Can you explain to us how the vaccine works? It's my understanding that it is an mRNA vaccine, which trains our immune system to recognize COVID.
That's right. So we've all now seen those very famous pictures of the coronavirus and its spikes or its crowns.
Yeah.
That crown is how the virus enters into our cell. And the virus's only goal in life, like all viruses, is just to make a lot of copies of itself in a human body. So that's how it enters into our cell, is via that crown. And what these new mRNA vaccines do is they block that crown from entering our cell. It's an amazing platform. This is the first time an mRNA vaccine has been rolled out on this scale. But there is a piece of reassurance I want to offer your watchers, Daniel, that although this is a new-ish technology, new-ish in science still means that it's been studied for 30 years. So this is the result of many decades of scientific research. And it is a really cool new platform that scientists believe is going to be really easily adaptable for other types of viruses too. So it's a pretty amazing breakthrough.
I agree. That's very amazing how we're making new technology like that.
Mm-hmm.
Normally, it takes 10 to 15 years to develop a vaccine, but the COVID vaccine was only developed in 1 year. How is this possible?
Again, I think this idea that this mRNA platform has been under study for 30 plus years helps us appreciate that this vaccine development has actually been in the works for more than a year. But part of why we were able to get from bench to bedside, so from science experiment to shots in people's arms so quickly, one, the scientific community around the world has collaborated on this at a scale that we've never seen before. There have been tons of resources, there's been tons of interest. We have prioritized getting this done, and on a scale so massive that it was able to be done quickly thanks to the resources and the collaboration involved.
Yeah, that really shows the power of teamwork and collaboration.
It truly does. It's been, as a scientist, I like to say there's nothing good about a pandemic. A pandemic is awful, but there are some silver linings that we can hold on to. And one of the silver linings for me as a scientist is seeing all the collaboration across previously competitive scientific groups. It has taken the whole scientific community to come together in response to this pandemic. And I do think my colleagues have risen to the cause.
Do you have any words of advice for those who don't want to get vaccinated because of the speed with which it was developed?
Again, I think it's really important to honor people's emotions here. So we have to invite an open, warm conversation around why they're having these feelings, around what the hesitancy is. And then I also like to understand who they trust. Who do they trust? Do they trust their school nurse? Do they trust their family doctor? Do they trust Dr. Fauci? And once I try to figure out who the right trusted messenger is or trusted influencer is, and young people speak, then I try to find good messaging from that trusted person or influencer, because everyone needs a slightly different message to make them feel confident and trustworthy. But for those for whom I have the great honor of being a trusted messenger of information, I like to say there have been no shortcuts on safety research for these vaccines. Zero shortcuts in the science. There have only been manufacturing increases that have scaled more quickly. No shortcuts on the science. The safety profiles look incredible to date. The effectiveness profiles look incredible to date too. And as soon as I have an opportunity to do so, I will get that shot in my arm. And I am delighted that my parents, who are elderly and are in Texas, have had the opportunity to get that shot. So I walk the talk in terms of vaccine confidence.
How will the distribution of the vaccine work?
Well, right now, there's a federal component. Like many things in our government, the federal government has a role, the state government has a role, and then the counties have a role. And as we see right now, we're having some hiccups. The federal government and the state government and the counties are still figuring out how to talk to each other, how to communicate, and how to figure out what their individual roles are. But for those, just some practical advice about vaccine distribution. For those of you who are interested in when you can get a vaccine and where it is, be on the lookout for information from your state and from your healthcare provider.
Speaking of the states, were you happy with the states deciding the distribution of the vaccine, or would you have preferred the decision to be federal?
So that's a great question. And I think I am somebody who has studied state health policy for my entire career. And one thing I have noticed from being on the ground in this field is that the needs of people in West Virginia are very different than the needs of people in Wisconsin. So in general, I very much like states having the flexibility to design public health programs that meet the needs of their populations within the settings of their resources. I do think that that causes a trade-off where we don't have a lot of federal standardization or centralization. So it causes a little bit of inefficiency. I think that trade-off is worth it, but many of my peers do not. So this is a very good question because it's a topic of disagreement, even among us health policy experts.
I agree that the trade-off was worth it because only a small region of people would be affected by the state's decision, and they're not deciding everybody because, as you said, their needs vary from state to state. What percentage of the population needs to be vaccinated in order to have the vaccine be effective?
That's a great question. And this is a phrase that we scientists called herd immunity. It actually came from veterinary studies about cows. So the parallels from cows to humans, pretty interesting. So this is the percent of the population that would need to get vaccinated to protect those in the herd who are too medically vulnerable to get vaccinated themselves. Under a herd immunity scenario is when the disease starts dying out with the same exponential decline that we see it grow exponentially absent a vaccine. So herd immunity, I actually prefer the phrase herd protection because we think about protecting our neighbor, protecting our grandmother who has a condition that means that she can't get a vaccine, protecting a medically fragile child, right? So herd protection. We think it's about 60 to 80%, but we don't know for sure.
Do you think that will happen considering that we are well below vaccination targets?
I think it will happen. I think the question is of when. The best way and arguably the only way to truly reach sufficient herd protection is through vaccination. And so what I look at, I keep my eye on how much vaccine confidence there is in the population against the 60 to 80% benchmark. And the good news is that survey data, polling data show that more and more adults are increasing their confidence in the vaccine and are expressing willingness to take it. And as long as we have enough people willing to take it as we need to hit that 60 to 80% threshold, we'll be in good shape. I'm an optimist, Daniel. I can't help it. It's just the way I'm wired. And I have a lot of faith that we're going to get over these initial distribution hiccups and soon.
I like that message. We will get over it.
We will.
What final steps do you have to take before the vaccine is distributed to that population?
Meaning, how do we convince them to take the vaccine, or how do we logistically make the last mile, as it's called in public health?
What final steps do we as individuals have to take before we can be protected by the vaccine?
Oh, I see. So what sort of personally protective behaviors should we sustain while we wait for herd protection thresholds? Great question. The same protective behaviors that we have been doing since the pandemic hit. So we nerdy girls use an acronym called SMART, and we need to keep staying smart. So S is for space. Keep it 6 feet apart or more from others. M is for mask. Keep it on. A is for air. Keep it fresh. Outside is best, or a really well ventilated indoor space. R is for restrict. Restrict the number of people in your pandemic pod. And T is for time. Keep your interactions short, ideally 15 minutes or less. So we need to keep staying smart while we wait for the vaccination campaign to continue to do what it needs to do.
I really like that acronym, SMART.
Thank you, Daniel.
Pretty creative. If somebody is vaccinated, does that person still need to wear a mask?
Absolutely. So there's still some pieces of the science that we need to figure out. One of those things is, we know the vaccine prevents really severe disease, really bad outcomes. We know less about whether or not the vaccine will keep you from catching a version of this virus where you don't get any symptoms. We think it will. So we think the vaccine will prevent you from catching COVID and passing it along, even if you're not feeling any symptoms, but we don't know that yet. So because of that, wear your mask. Also, vaccines take some time to kick in. Our body needs a little bit of time to mount a happy, healthy immune response. So especially while you're first vaccinated, your body hasn't kicked in yet with the full response. So it's important to stay masked. So get a vaccine, keep wearing your mask.
And stay smart after you get the vaccine.
And stay smart, exactly. The same protocols apply.
Where do you think we as a country went wrong with our approach to stop the spread of COVID?
Oh boy, this is a hard one. And I think wiser people than me probably have more insight, but I think we in the United States have been lucky. We have not faced a major respiratory pandemic. We have been spared the worst of the recent pandemics like MERS, which was similar, it was a respiratory pandemic, and SARS, the first one, which hit Asia. We were spared the worst of Ebola. We are not a country that has dealt with serious pandemics like this in recent history. So I think we were caught a little bit flat-footed. I do have to believe that our pandemic response will get better after having gone through this, because it must. Because while I am an optimist, I'm also a scientist, and candor is important here. This is not going to be the last pandemic threat.
So we'll learn from this experience and be better prepared next time.
That's right. And I do hope that we put more funding and more energy, and we have more smart young minds like you who are incentivized to go into public health and into pandemic response. It has not been an area of science that has been well funded. It has not been an area of science that gets a lot of prestigious awards. And these are the sorts of incentives that we need to entice smart people like you and others of your generation to grow up thinking about these problems so you can solve them for me and older generations.
Do you think that mask wearing will be our new normal?
I don't know. I think it will be around. I think it will stick around for a while, even after we reach the herd protection threshold. I think some people will be nervous to take their masks off. So I think I count myself among them. And I think we will all be made more aware that mask wearing is an option when we're feeling sick or when we're feeling vulnerable to others who might be sick. So I do think they're here to stay, although perhaps not with the ubiquity we wear them now.
Can you tell us about the mutant strain of COVID that has become widespread in the UK?
Sure. So there are two strains of the SARS-CoV-2 virus, one in the UK and one in South Africa, that have been raising some pretty serious alarm bells. And here's what's going on. Viruses replicate, or excuse me, they replicate, but they also mutate, they change over time, and that's to be expected. So we knew that this virus was going to change, and indeed it's already had a couple evolutions of changes. But the reason why this one is raising a red alarm is because it makes the virus, this variant, is more catchy, it's more transmissible, it spreads more easily. So while it doesn't tend to make people more sick, it does make the disease spread faster. And we know that the more people who catch this virus leads to very bad outcomes. So this is why we're worried about it. Again, I want to inject a little bit of cautious optimism. Pfizer has done a quick study that has demonstrated that its vaccine is effective against this mutant strain in the UK. Moderna thinks its vaccine probably is too, and they have that study launched right now. So there is some cautious optimism that this virus, this variant, won't do what we call escape the vaccine. So vaccine escape is a problem we scientists worry about, but hopefully this variant won't escape.
It's relieving that you think that the mutant strain won't escape, but we still have to stay careful, and like you said, cautious optimism.
That's right, and I think these variants that we're seeing that are more transmissible needs to be a wake-up call for those of us who aren't staying smart with the SMART principles. Now is the time to double down on your SMART behaviors because the vaccine is coming. Hope is on the way, but we have got to move through this pretty dark time in the pandemic. And the best way to do this is to use the SMART protocols.
What does a 95 efficacy rate mean? How does it compare to the flu vaccine?
So a 95% efficacy rate means that in 19 of 20 people vaccinated, they will be protected against the virus, which is pretty remarkable. So unfortunately, that means 1 in 20 people won't be, but 19 out of 20 is a tremendous efficacy rate for vaccines. Flu vaccines, they change every season because the flu virus is good at escaping any given vaccine regimen for a given year. Flu vaccine can be anywhere from 40 to 60% efficacious, which is still a really good tool for blunting the impact of a flu season. But frankly, the efficacy rates that we're seeing for the vaccines right now have exceeded all of our scientific expectations.
And in some cases, the COVID vaccine is twice as effective as the flu vaccine.
It's remarkable. Yeah. The efficacy is just truly remarkable.
The Center for Disease Control guidelines change on a weekly basis. What is the best way to keep up to date?
I think keeping up to date by continuing to read the CDC is a great way. You know, their language is a little bit dense and technical. So part of our mission at Dear Pandemic is to translate dense technical language into stuff that we all can just understand using our everyday terms. So, you know, we are happy to be your source of information. We'd be honored to serve those needs, but we keep up with the CDC, we keep up with the World Health Organization, we keep up with the FDA, and we keep up with the newspapers.
I think that's great that you're helping people to decode the scientific data, and it's obviously helping a lot of people.
Thanks, Daniel.
Studies have shown that African Americans have a higher mortality rate than others for COVID. What are the factors contributing to this statistic?
We have an unfortunate history here in the US when it comes to medicine and the Black population. Unfortunately, there have been incredibly unjust racial disparities in health status and healthcare seeking for Black and Brown communities relative to white communities. And we, unfortunately, are living the legacy of that through this pandemic. So let me be very clear. There is nothing wrong with Black or Brown bodies. This is not their fault. There are just higher rates of chronic conditions that we know lead to bad COVID outcomes in these communities because of this historical legacy of segregation, of lack of medical care, of unjust practices all across public health. You remember I started by telling you about all the influences on our health that are outside the medical care system. Unfortunately, many of these too also have had discriminatory pasts and legacies. So it is a tragedy.
I read an article recently about an African American physician, Dr. Moore, who was denied adequate treatment while battling COVID. And while we don't know all of the details of medical treatment, it lends itself to the question, as you said, of a disparity in healthcare treatment.
And one thing I would love to see, and this is actually a kind of a personal cause of mine, is training more Black doctors and nurses and clinicians. Because I think to rebuild trust in the medical system, we need more clinicians from minority backgrounds. So this is a huge interest of mine where I like to donate my money.
I agree that having more physicians that are minorities would help the situation. What do you want to say to those people who do not take the pandemic seriously? For example, somebody who thinks the virus is a hoax.
This virus is not a hoax. This virus alone killed over 4,000 Americans yesterday, which is more than heart disease and cancer combined on a daily basis. Hospitals in Los Angeles are operating in what's called crisis care mode, making really hard decisions about potentially not being able to treat everybody. This is not a hoax. This is a crisis.
I agree. And obviously the results are right there. It's killed so many people, caused so many hardships. How can you think it's a hoax?
Exactly, Daniel. I am with you.
Do you have any final words to close off the discussion?
Thank you for having me. I really would like to encourage people to keep staying smart. As I said, hope is on the way in the form of a vaccine. And one form of hope that I have, Daniel, is talking to you and other smart people of your generation. It gives me hope that if this ever comes around again and you guys are in charge, and when you're my age, we're going to do a better job. We're going to do a better job of fighting it.
I really like that message of staying hopeful. We've had a great discussion. We talked about the misinformation about COVID, the vaccine that will help to stop the spread, and the racial and ethnical disparities woven into our healthcare system. To all of our viewers, I hope you will join us for our next episode. Thank you again for being on the show, Dr. Leininger.
Thank you, Daniel.
Thank you so much. I'm Daniel Adibi, and I'll see you soon.